All right, this is what your treatment plan is going to look like. So here you're going to have a passive and an active. Passive is going to be when the pedals move for you. You'll just be following the range of motion. Active is going to be when you actually start to pedal. So for the sake of the demo right now, it's going to say 1 minute and 1 minute. But after your surgery date, it'll say 10 minutes of passive with 2 minutes of active. So each session's about 12 minutes long.
Okay.
All right. Now something you have to remember, about every 3 days or so, this is going to kind of change up. It'll put a little bit more active in there, less passive. And on the 7th day, you'll get that resistance, which is why we want the chair back against the wall so you don't push yourself back.
Okay.
Down here at the very bottom is going to be your sessions per day. Right now it says 1 of 8. After your surgery date, it'll say 1 of 5. You're going to try to do 5 sessions a day and space them out 2 hours apart.
Okay.
All right, so we'll go ahead and tap on next here. Here it's going to adjust the pedals back to pedal position 1, where you'll be starting off. Perfect. So here before every session, it's going to ask what your pain levels are. So you'll go ahead and answer that. 0 being not so bad, 10 being the worst. You just tap on a number or you could drag it around. Totally up to you. Then you'll tap on next. Then here it'll ask when's the last time, or if you're experiencing any excessive pain, swelling, stiffness, or draining. So the only problem with this question is if you do answer yes, it will prompt you to call your doctor and it will not allow you to do the session. Okay?
Okay.
So for now on the demo, we'll just tap no. Then here it'll ask when's the last time you took your pain narcotic medications. This will be only narcotic, no Tylenol, ibuprofen.
Okay.
All right. For now, we'll just tap on no prescription, but you'll answer this honestly after surgery. And hit next once your feet are on the pedals. At this point in the prompts, you want to have about a 90 to 100 degree bend in the knee with your feet initially on the pedal.
Okay.
So once you have that, you're going to go ahead and tap the little circle, put a little check mark in there, and then you'll hit next. And then here it'll take you through passive mode. It'll count you down from 5. And you'll notice as the pedals move on their own. And you'll just be following that range of motion, trying not to resist it, and just really let it take you for a ride. So this screen here is going to pop up periodically throughout your session. This is going to be to increase or decrease the pedal position. And what that means is right now you'll be starting off at pedal position 1 of 6, which is the lowest range of motion. So every time you hit this green increase button here, this is going to go up 1 level. Every level is going to give you a tad bit more range of motion in that knee. Once you get to 6 of 6, the pedals will adjust all the way to the outer of the wheel, and that's where you'll get the full bend with the full extension.
Okay.
So your goal, this is going to be something you work on at your own pace. You just hit this green increase button, day by day, however you're feeling. Slight discomfort is normal when increasing it. If you feel any sharp pains or anything like that, definitely decrease it. Maybe stay at that pedal position for the day, and then maybe try to up it again the next day.
Okay.
All right, and just make sure when this screen does pop up, make sure you always hit stay, because it'll keep that timer pause at the top to give you maximum amount of time in that pedal position.
Gotcha. Okay.
So we'll go ahead and tap on stay there. Now, doctors do recommend just for the first 3 days after surgery, just to keep it at pedal position 1. But after the 3rd day, if you did want to increase it, and that screen has not popped up for you, you could always tap this pedal icon to the right of the timer, and that'll pop up the screen for you where you could increase, decrease, however you're feeling.
Okay.
All right, and then just make sure whichever one you decide to choose, always hit stay. So we'll go ahead and tap on stay there. Perfect. Up here in the top left is going to be your pedal position, what pedal position you're currently at. Right now it's at 1 of 6. For any reason, if you did need to use the restroom or take a break, you can hit this stop hand up here in the top left. It'll pause it for about 15 minutes. Just make sure you're back within 15 minutes or the session will reset.
Okay.
All right. Well, this goes for another 20 seconds so we get to active mode. Green light here. This stays on at all times. It stays plugged in. If you guys decide you guys do want to move it elsewhere, that is perfectly fine. Just make sure once you unplug it and move it, and you plug it back in, and that green light is on.
Okay.
All right. This button right here is going to be your emergency stop button. Just in case this passive mode is too much pain, you'll just push it in, and it'll shut the whole bike down.
Oh, cool.
Yep. And then you've got your 2 volume buttons here. The far right one is going to be your volume down. One to the left of it is volume up. And there's a full audio feature that will walk you through each prompt that we're going through and kind of guide you in the right direction. All right, so now here we're in active mode. As you pedal, that gray dial in the center is going to move. Turn it down a bit. Yep. So as you pedal, that gray dial is going to move. You just want to keep it in the blue as best as you can. So nice steady pace, not too fast, not too slow.
Okay.
So for the passive mode, you'll do that for about 10 minutes. For the active mode, you'll start off doing 2 minutes. That's pretty much it.
All right.